What's a pacemaker like? Tell me what you do now to get people healthy.
Certainly. So a pacemaker is wonderful. It's gotten to be very small. I brought one. So the pacemaker is a bit larger than a quarter or maybe a $50. It's inserted under the skin, and then it has a cable or a lead that goes through the blood vessel to the heart. And the lead goes into the heart muscle. And a pacemaker ensures that the heart never goes too slowly. For example, a pacemaker we could set at a rate of 60, 1 beat per second. And
so if it gets below that, it comes on or it stays at 60 no matter what?
Right, so it will never let the heart rate go below 60, a properly functioning pacemaker.
So if you've got a tachybrady, what do you do with that?
So they would typically get medications for the fast rhythm, the atrial fibrillation, and then a pacemaker for the slow heart rates.
Now they've got some new advances in pacemakers?
We do. So this would be called a single lead or single chamber pacemaker for the lower chamber.
So that's going to go in through blood vessels to a lower chamber.
Correct. And we have dual chamber pacemakers for the upper and the lower chamber.
Why do you want upper and lower?
To keep the organized electricity, upper, lower, upper, lower.
So the upper throws it into the big pump, the lower, and then the big pump sends it out to the body or the lungs.
Yes.
So what does that look like?
So this is a dual chamber pacemaker or a 2-lead pacemaker where this lead goes in the upper chamber of the heart, and then this lead goes into the lower chamber of the heart.
How difficult is it to put in a pacemaker? I see people all the time have pacemakers.
They do, and in fact, even the elderly patients, patients in their 80s, 90s, 100 years old, we would still put in a pacemaker if that person is walking and doing their activities at home.
Now you've got two other devices we want to show here.
We do. The most recent pacemaker is called a leadless pacemaker, which you can see is very small.
So on this one, you don't have any wires.
Correct. This one has no wires. It's with a catheter procedure. It's implanted in the heart. That's good for 10 years. It functions on its own.
And then when it finally tires out, you can put another one in, or you just see what you need to do at that time?
Correct.
And what's the other device that you have?
The final one is also a small device, like the 30-day monitor. This will monitor patients for up to 3 years. It's inserted under the skin on your chest wall over the heart, and it monitors the heart for the next 3 years.
So it tells the doctor, how do you get that information? It sends it through a phone, through a cell phone, vibrations?
We do. Yes, basically it interrogates and sends the information via cell phone.
You cardiologists are amazing. It's just, there's so many advances that are going on, and it all is made where people are able to live a more functional life and live longer and longer.